The UVA health system launched a new healthcare delivery system today. The program is being run through the medical center's heart clinic, or the Club Red Clinic. Doctors say they realize that there's a need for gender-specific cardiovascular care, which is why UVA decided to launch a women's heart clinic. The new clinic will offer a variety of healthcare options.
And our goal is to help women reduce their risk through a variety of different types of interventions.
Tucker says those interventions include diet, exercise, and other medications. Well, there's disappointing news coming out of a new study by the American Heart Association.
And that study finds that there's a gender gap when it comes to the quality of care for patients who have suffered serious heart attacks. CBS 19's Mark TENIA joins us now live in the Newsplex with more. Mark?
Yes, according to the findings, women were 12% more likely to die from a major heart attack in the hospital than men.
Since 1984, more women than men have died each year of heart problems. But there still is a societal misperception that it's a disease of men.
That's one of the reasons doctors say may be the cause of a gender gap between men and women patients who suffer serious heart attacks.
We've known for a couple of years now that the treatment of men and women, despite our best intentions, sometimes turns out to be different.
A new study of over 400 hospitals showing a gender divide in care, with 10% of women dying in hospitals after suffering a major heart attack compared to 6% of men.
There's still a difference not only in how many of those women will die, but also in how they're treated.
We know that now heart disease kills more women per year than men, but it's still often seen in our society as a men's disease.
Doctors say that in order to close that gap, doctors and women need to be more educated.
I think providers need to be on the lookout for heart disease in women, and women also need to be aware of those things.
And while the medical industry has made some progress, doctors say there's still work to be done.
So the good news is it's improving, but the bad news is that we still have a long way to go.
And symptoms can be different for women. Doctors say that women should see a physician if they experience any chest or abdominal pains. Live in the Newsplex, Mark TENIA, CBS 19 News.
All right, thank you, Mark. And that study looked at almost 80,000 victims of heart attacks. Well, the sluggish economy has